If your pet has been diagnosed with arthritis, chances are you've had at least one conversation with your veterinarian about whether pain medications may be appropriate for them at this point. There are a lot of different ways we can treat arthritis these days, and while that is wonderful, it can sure get complicated and overwhelming. So I thought I would spend a couple of videos just talking about the different ways that we can treat arthritis and the options that you have. In this video, we're going to focus on medications, so things that are taken by mouth by the pet. We can divide these into three categories. We have the anti-inflammatory medications, we have the adjunct pain medications, and then we have supplements and nutritional support. Let's start with anti-inflammatory medications. This comes from the category of non-steroidal anti-inflammatory medications, or NSAIDs. NSAIDs are considered the foundation of arthritis treatment. They are really, really good at reducing the inflammation in the joints, decreasing pain, and helping your pet function fully and comfortably. Whenever we can, we try to treat a pet with NSAIDs when they start showing signs of arthritis. If the pet has a medical condition that they can't take the NSAIDs with, or if they don't tolerate them well, get stomach upset, then it may not be an option for them. So you need to discuss this with your veterinarian. But in general, whenever it's a possibility, we really try to get all pets that are already having pain from their arthritis on these medications. Arthritis is a chronic and progressive condition, so it can't be cured and it does get worse over time. So there is a chance that after some period of time, the NSAIDs alone are not going to be enough to treat the pain. Fortunately, we also have adjunct pain medications. This is just kind of a general category of very different types of medications that work in different ways, although generally they all work on the central nervous system. And what they do is we layer them on with the NSAIDs and they enhance their effects. So because they work differently than the NSAIDs, you get a synergistic effect between the two without a lot of overlap and side effects. So they really are more than the sum of their parts when you use them together. And then finally, we have nutritional supplements and nutritional support for arthritis. There are specialized diets that are formulated to reduce joint inflammation and support joint health. And there are a number of supplements that can be taken in the form of a capsule or a tablet. Some of these supplements include things like omega-3 fatty acid supplements in the form of fish oil. It might be ASUs, green lip mussel, and glucosamine and chondroitin are the most popular, although there are more. There is an injectable called Adequan. It's actually considered a medication by the FDA because it is given by injection, but it works similar to these other types of supplements. All of them have different levels of research backing how effective they are, and I really advise you to talk to your veterinarian about the latest evidence and which of these could be helpful for your pet. And these supplements don't have to be given as a last resort. In fact, often they are the first thing we do to treat arthritis. So when you combine NSAIDs, adjunct pain medications, and nutritional support for your pet, you have a really good chance of making sure that they are as comfortable and as functional as they can be as they live with this chronic condition. My name is Carolyn Nawn, and I am the owner and medical director of Arms of Aloha, where we believe every pet deserves peace, comfort, and dignity at the end of their life. If this was helpful to you, please share it with your friends. And if you have other topics you would like me to talk about, drop us a note in the comments.